buckets. Some of y'all will get that in a minute. Okay, the New York City Board of Health, they have declared racism a public health crisis. They passed a resolution declaring that racism is in fact a public health crisis. The 4-page resolution, which passed on Monday, went into effect immediately. Now, people are outraged on the other side of this. So obviously racist individuals are saying, oh my goodness, look at the woke culture permeating through governmental entities. And then you have those who are just on the wrong side of the narrative, wrong side of the conversation. The data is clear. Doctors who have gone to college all of these years, who are learned individuals, are still exhibiting implicit bias that they were unaware of, where black people are on the short end of that bias. You can't tell me that doesn't bother you as a medical doctor. I'm bothered by professors. I'm a college professor. I'm bothered by professors who have inequitable outcomes as it relates to their black and brown children inside of colleges. That bothers me. So I fight against it. Why does this not bother you?
You know, you're putting words in my mouth. Because I think that the emphasis is on the wrong thing. First of all, that is not all doctors. Certainly, in my experience, you know.
No, it is a statistical significance. That's why you have macro and micro data, madam. Come on, now you got a medical degree. We don't have to go through quantitative. We don't have to go through.
I have worked that. I have a public health degree, and I've taken statistics for many years. That's why I'm saying that I am not going to just follow this hook, line, and sinker.
Madam, you have all of these degrees. I got a bunch of degrees too. You and I both understand the reality of the framework, qualitative and quantitative research, comparable data, theoretical framework versus actual data. You mean to tell me that this actual data does not bother you in your profession? This month.